Good afternoon, I'm Richard Weston and I'm the CEO of the Healing Foundation, and today we're in Canberra at the Healing Foundation office, and just as a preview to Indigenous Health May Day, we're talking with my mother, Thelma Weston, who has a long career in health. And I'm just going to ask her a few questions, and she's going to just tell us a few yarns about her career. Hello, Mum. How are you?
Good, thanks.
That's good. So, do you want to tell us a little bit about your, your history? How did you get into the health? Where did your career start in health?
Well, when I was 17, I decided to do a nursing course at the Brisbane General.
Okay.
And in those days, you didn't have to have a good education as long as you did year 7.
Okay, so that was back in the dream time, wasn't it?
Yeah, no, long dream time, yeah. And we grew up in Brisbane, and we had been evacuated from the Torres Strait Islands,
Yeah.
or from Murray Island, because of the war.
Right.
So because of my parents had made the decision to go to Brisbane,
Yep.
where a lot of other people from the Torres Strait Islands lived in Cairns, Townsville. Yeah.
Okay.
So that's where we grew up, in Breakfast Creek.
And how many in the family at the time?
There was me and my brother and my older sister. So we were born up in the Murray Islands, and and then 4 younger brothers were born in Brisbane.
Okay. All right. So how did you tell us about getting into health? Where did that start?
Oh well, we did an application, got
accepted?
got accepted, and then started my general nursing training.
Okay. And then what happened from there?
Well, Mum got sick because she had these 4 young brothers of mine, and she was quite ill for a while, and I had to defer my nursing and look after her until she got better, and then I had to look for a job after that, so I joined the army.
Oh, okay.
Yes.
All right.
Yeah.
And what happened when you were in the army?
Oh, well, you do basic training, and we did basic training in Queenscliff in Port Phillip Bay, and then did the training in medicine up in the Army School of Health at Higglesville.
Oh, okay.
Yeah, so that was, must have been about 3 months, I would say, because I remember we were in Hillsville when the Melbourne Cup was on.
Yeah, okay.
Yeah, so, and then I got posted to Brisbane, the camp hospital in Yoronda in Brisbane.
And then that's where you met Dad when he
Yes,
was...
yes.
Yeah.
So, and from there, because you couldn't stay married if you were in the army. For women, you had to get out. So,
Oh, really? Wow.
yeah, it's like, the teachers and police, you couldn't, even the public servants, once they got married, they had to leave
Their
the
jobs.
public service, yes.
Oh. Well, there you go.
Yeah, so, yeah. And then we got married in Brisbane, and then went to Sydney to live, because your father was still in the army, and when he got out, you were born then in Brisbane.
Sydney, yeah.
In Sydney,
Uh-huh.
and so we were going, Dad got out of the army, he'd done his 6 years, and we were going to settle in Sydney, because
Yeah.
it was closer to my family in Brisbane. And then unfortunately, your father's mother had breast cancer, so he went back, he took you to Perth, and I had to follow because he wasn't coming back to Sydney.
Yeah, okay.
Yeah, so you were about 7 months old when your father took you over.
Yeah, I remember it well.
Yeah.
So,
Yes.
so fast forward to now. You're
Yes.
still working at Woononga
Yes,
Health
Woononga
Service?
Nemetidja Health Service.
And what do you do there?
Well, I manage the needle and exchange program and plus the admin reception as well.
Okay. And are you happy to tell the audience how old you are?
Oh, well, I'm 81 this year.
Okay, and you're
Yeah.
still working.
Yes.
Okay.
Yes.
Well, I hope I'm still Well, I hope I'm not still working for it. I'm 81.
No. Well, it's just something that I got into because they were looking for, because I'd retired.
Yeah.
And we came to Canberra to live, and then they wanted someone to help with some of the students.
Yeah.
So that's how I got to Woononga, and then they asked me would I be interested in doing, being employed there as a health worker,
Yeah.
because there weren't that many health workers at the time.
Okay.
Yeah.
So you did train as a health worker in WA.
Yes, at Mumwooditch.
At Marmwooditch, yeah.
Yeah.
So where did you work in Perth when you were?
Derby-Oregon Health Service.
Oh, okay.
Yes.
And what sort of work were you doing
Well,
there?
I was a senior health worker there.
Yeah. Yeah, okay.
And looking after people like the nurses and the other health workers. So there was about 8
So you were
staff
coordinating their work,
their
yeah.
services. And
Oh, yeah.
yeah.
So how long? When did you leave?
I left
That.
in 2003.
Okay.
Because Dad had retired
Yeah.
and then the house was sold. We packed up and then we came to Canberra to see if we liked being
Canberra.
in Canberra, because the sister was living here then with her 2 boys.
Yeah, Jackie. Yeah.
Yeah.
Yeah. Oh, and Sandy. Yeah.
Sandy and yeah.
Yeah. So what? So what do you think? What do you think needs to happen today to improve outcomes in health? What are sort of things do you see that are challenges and maybe some of the things that need to change?
Well, maybe they need to, a lot of the funding needs to go into the community control sector, because, you've, through my experience with Aboriginal health, because I had done nursing in a nursing home while you kids were growing up.
Yeah, yeah.
And, but now, you'd get programs that would be really good, and then they'd cut the funds.
Yeah.
So, and maybe the government needs to look at the money that because there's a lot of community controlled organisations, and, and we can't, their funding's not that good at the moment, Not that I know anything about it.
Yeah.
But yeah, and I think that it's it's just not fair.
Yeah.
Anyway, yeah.
Well, there are.
Yes,
There's 140 AMSs around the
Yes,
country,
yeah.
and they provide great access to the health system
That's
for
right.
Aboriginal and Torres Strait Islander people. So they're very important, and we
Yeah.
should have more of them, I think.
Oh yes,
Yeah.
yes. And upskill some of the workers too,
Yeah.
because a lot of the workers in the AMSs, they don't get a chance to do professional development
Yeah.
because of the workload that they have to do.
Yeah.
And it's really hard because you have to go, if you want to do extra training,
Yeah.
which enhances the health workers.
Mm.
And being on the board of NATSA too.
Oh, that's right. You're on the
Yes.
board of the National Aboriginal and Torres Strait Islander Health Worker
Yes.
Association.
Yes.
Yes.
Yes, and we started off in Perth,
Okay.
at Derby-Oregon. We started that off with the health workers and we used to meet. That's
Yeah.
how it started.
Who's the CEO over there now? What's his name?
I'm not sure.
No, it's Carl Briscoe, isn't it?
Oh, Carl,
Yes.
yes. Oh, no, I thought you were talking about the one in Perth.
Oh, no.
No. Yeah, Carl, yes. No, and at the moment, the staff's really settled now,
Yeah.
you know, and we've got Carl's a great CEO. You know,
Oh.
and, yeah.
There you go, Carl. There's a plug from one of your board members.
Yes, and also we've got a full board complement now,
Yeah.
where we didn't before. We've got people from each state.
Oh, fantastic.
Yeah, from Kalgoorlie, the Northern Territory. Yeah.
Do you know how many members you've got there? How many health
about
workers?
700.
God, that's a pretty significant chunk of the health workforce, isn't it?
Yeah, well, a lot of them are the health practitioners and the health workers.
Yeah.
And there's other people, you know, friends of the Natsawa and
Okay. So do you want to send a message to, you know, because we have got Indigenous Health May Day. Do you want to send a message out to the punters that might see this video clip? Do you want to say anything?
Message?
Whatever message you would like. Big hello, big SO.
Yes.
Look at the camera there.
Just to say that the health workers are really doing a good job, and there should be more of them, but because of restraints with funding, they don't often get recognised.
So, Mum, obviously you've been working for a long time and you're still working. So, how have you, you know, kept your health up? What sort of things have you done to?
Well, I think when I was younger, I probably played a lot of sport, which you do when you're young, and I used to ride my push bike to the hospital.
Okay.
When you kids were little.
All right. So you think that's helped you now?
Yeah, I think it did. Yes.
So what sort of sport did you play?
Well, I played hockey and softball.
Yeah.
Yeah.
And you did you play representative?
In school. Yeah, represented Queensland in softball.
Oh, fantastic.
Yes, and golf. I loved my golf.
Yes. I think my sister Jackie was a golf orphan. Well, thanks a lot, Mum. It's really been great talking to you, and I think just listening to you, you know, tell us a little bit about your life and your history, and you know your views on health. I think that I think some of the things that I've learnt from you are really about everybody. We all need an education, and I know when we were young, you and Dad really hammered that, especially you, and you really did ensure that all of the kids, me and the 4 girls, got an opportunity to get a good education, because you often told us that the basis of a good job is a good education. So I think you achieved that, but I also think that just your persistence and determination to always do something, be there for the family. You know, you've been the rock and the glue that's held us all together over many, many years, and over, you know, we've experienced a lot of heartache in our family, loss of family members and so forth, but you've remained steadfast and strong through that. So I think that's been a lesson for me about, you know, courage and strength, and I think just and you know, I think I've learned what I've learned from you and Dad has helped me really create opportunities for me to work in a space that I think is really important to work in. So trying to make change for Aboriginal and Torres Strait Islander people, and also to work in, you know, to have a voice in, you know, things like policies, or be critical of things that aren't, you know, that governments might do that aren't right. You know, and also, you know, just support younger people coming through, and support them to get education and get jobs. I mean, having a job is really important for everyone, and I think the more opportunities we can create for, you know, young people, then, you know, the better lives they're going to have, better health they're going to have. And we've certainly tried to do that with your grandchildren, my kids. So they've all had an education, and they're all working, which is fantastic.
Yes,
So we just hope we can get that sort of generational change. But thank you for speaking to us today, and thank you for being my mum. And do you want to say anything to people about your wonderful son?
Well, seeing that I've only got one son and we've always supported him, and when he was growing up, made sure that he went to a good school, and so I'm really proud of him, what he's achieved.
Thanks a lot, Mum.